Hi guys, this is Dr. Curran with Bloomington Wellness Center. Today I'm going to show you some tips and tricks for some of my favorite exercises. Alright, so pelvic bridging is a great exercise for core strength, but there's a few things that we should go over with the mechanics, so I'll show you how to do it. So I'm going to lay flat on my back. And what you want to do with the pelvic bridge is really focus on engaging the glutes. So you really want to flex through the glutes, lift that hip up, and you want to have a nice straight line from your shoulders all the way to your knees. What we see in a lot of our patients is they're either sagging through the butt or they're overextending through the back. So you really want to try to keep a nice flat stomach, bring that belly button in towards the spine and keep a nice engaged core. And that's going to give you that nice flat line through the hip bridge. Okay, so there are a few progressions that you can do once you have that baseline of the hip bridge. So you can either sustain the hip bridge for about 30 seconds. That's going to give you a nice strengthening through the lower back and the core. Otherwise, you could do repetitions of going up and down. A few other things that you could do would be a march. So you really want to be focusing on keeping nice and stable through here. You lift one leg up, bring that down, lift the other one up and bring that down, and you could move through repetitions of that. Another one, this is a little bit more challenging. Bring one leg completely straight out and do a full lifting hip bridge with that leg extended. And then we'll switch. And there you go. Now we're going to show you some Supermans. So I've got my intern Darius here on the table. Say hi. So Darius is a pro here at the Supermans. I'll have him demonstrate one for us right now. So what you really want to be focusing on with this is really engaging through the glutes. That's going to help you get a proper extension through the lower back, and then engaging through your erector spinae muscles, which are those postural muscles. That's going to help lift the upper back up. So I'll have you come down, Darius. A few variations that you can do with the Superman are just repetitions up and down. So Darius, I'll just have you do a few for us here, just straight up and bring that down and up again for us. And down. So you could do anywhere from 10 to 15 to 20, depending on how your back is and how your pain feels. Another variation of this one would be an alternating arm and leg. So first I'll just have you alternate right arm up and left leg up for me. Perfect. And bring that down and then alternate the other one. All right, the pelvic tilt is a great building block to core exercises. It seems really easy, but it's something that you really want to be focusing on and using in more advanced exercises. So I'm going to show you here on Darius. What I'm going to do is just slip a hand underneath his lower back. And on most patients, what we find is there's this gap between the spine and the table. So what I want Darius to do right now is actually drive his belly button down towards my hand. And as you can see, he's rocking that pelvis backwards. So I'll have you repeat that for me. So see how his pelvis is almost tucking under, and we're driving that pelvis right up towards the ribs. And what I'm feeling right now is that his back is pushing right down against my hand and against the table. That's exactly what we're looking for. So the dead bug is a progression of exercises that we use to treat patients with lower back pain and build a lot of strength in the core and in the lower back. So I'm going to have Darius demonstrate just the basic dead bug here, so I'll have you get into the position. Now earlier we made a video on the pelvic tilt, so you really want to be focusing on that pelvic tilt when you're in this position, making sure that the lower back is nice and flat to the table. So this is actually the first progression of the dead bug, just sustaining in this position here. And this looks like it's easy, but it actually can take quite a bit of concentration and coordination through that core. So for the first progression, what I'm going to have Darius do here is just alternate his arms. So he's going to kind of get a swingy motion, but I'm not going to let him bring his arms past 90 degrees in front. That's really going to focus on engaging that core a little bit more. Perfect. And you can relax there. Now once we get comfortable with that progression, we're going to move on to the second progression. So for this one, Darius is actually only going to focus on the legs. So I'm going to have him extend one leg all the way out, and again, really focus on keeping that core nice and tight. Bring that up, other leg out. Perfect, and you can bring that up. So that's progression number 2, and now when we're working into progression number 3, we're going to be alternating arms and legs. So I'll have you demonstrate that one for me, Darius. Great. See how nice and stable he is through the core here. Perfect. So again, these are a progression. You really don't want to rush straight into that third exercise right off the bat. Make sure you're comfortable with progression 1, progression 2, and then get into the third one. So a lunge is a really great exercise to start building some strength through the legs and through the glutes. Now there's a few different things that we want to focus on with the lunge. The first one is making sure that your hips are nice and straight forward. If you're doing a lunge and you're kind of at this angle here, that's going to put a lot of stress on the knee and on the hip, and that could start to cause a little bit of pain up this chain. So what you want to focus on first, bring one leg forward, really square off those hips, and then just slowly lunge forward down to a 90 degree. So you can see how my knee is right above my ankle. If you start lunging forward, that's going to cause a lot of pain in the knee as well. So you want to be right at about 90 degrees with the top leg and about 90 degrees with the bottom leg, and then come straight on back up. So I'll demonstrate with the other leg. Good, and then I'll give you guys a demonstration from the front. Nice and squared through those hips. There we go. All right, so the hamstrings are a huge muscle group. It's 4 muscles actually right in the back of your leg, and they have attachments point to the hip all the way down into the knee. So this can cause knee pain, it can cause hip and lower back pain when the hamstrings are too tight. So I'm gonna show you 2 ways to stretch out those hamstrings. First one is just a standing reach. So you're gonna reach down, you wanna stay nice and straight through the knees and get all the way down, try to touch those toes. If you can go even further and go flat palmed on the ground, that's awesome. And you want to hold that stretch for up to about 30 seconds, okay? So just like that. And then if that starts to cause a little bit of pain in the lower back, an easier way to do this is to actually get down on the ground. So again, I'll show you 2 variations of a hamstring stretch here. One of them is just sitting and reaching forward like this. And this takes some of the activation out of those lower back muscles, so you're really not putting a whole lot of strain in the lower back. If this is too hard for you still, what you can do is bring one leg in, kind of into a hurdle stance, and then just reach down for that other foot. And we'll show you a switch. Just like that, super easy hamstring stretch. All right, calf stretches here. I'm gonna show you 2 different ways to stretch out your calves. So there's 2 big muscles down there that we kind of call the calf. There's the gastrocnemius and the soleus. So I'll show you 2 stretches to kind of attack each one there. So the first one here, what I'm gonna have you do is just get into a position here where you've got your heel on the ground and your toe right on the wall. And then all you're gonna wanna do is, I like to stabilize my hands on the wall just so I have some good balance. And you just wanna lean straight in. And I can feel that pulling straight up my calf. And that's a really great stretch there, but if you wanna get a little bit more intense, I'm gonna come back to that neutral position, give a bend through my knee first, and then lean in. And you're gonna feel that pulling almost down right into your Achilles tendon there. 2 great ways to stretch out the calf. Traps and levator scapula. These are some really big muscle groups right in the upper part of the back, and they can start to cause some tension in the upper back and even pull up into the head and cause some headaches. So we've got a couple easy ways to stretch out those muscles here. So I've got Darius here, he's gonna demonstrate for us. What I'm gonna have you do, Darius, is take your hand and actually sit on it with your palm up. And what that does is it's gonna stabilize this shoulder where it is, and it's gonna anchor that point down and give us a little bit of a better stretch. So with your opposite hand, what I'm gonna have you do is grab the side of your head and then pull straight across from that shoulder. So you can see his shoulder stays nice and stable here, and we're getting a really, really great stretch right along the side of the neck. So for the second variation of this stretch, coming down a little bit more into the levator scapula muscle, what I'm gonna have Darius do is still stabilize that shoulder. He's gonna turn his head away from the shoulder that he's stabilizing, and then I'm gonna have you grab the back of your head and tuck your chin down towards your chest. So he's looking at about a 45-degree angle right past his knee, and that's a pretty common area where most people are gonna notice a great stretch. But if that's not great for you, what you can do is bring it a little closer. So I'm gonna have you look a little more towards the knee. Perfect. And you can even come a little bit wider all the way out to here. So find a great angle within that kind of 90-degree zone of what's giving you the best stretch and hang out there for a little bit longer. The iliotibial band is a large piece of fascia that spans all the way from the hip down towards the knee. So when this piece of fascia gets really, really tight, it can actually start to cause hip, lower back, or even knee pain. So today I'm going to show you how to foam roll that. Let's talk a little bit quickly about foam rollers first. You want to find something that's really, really sturdy. You can see this doesn't have a whole lot of give to it. There are a few out there on the market that are kind of like a pool noodle, and those really aren't going to give you the best amount of support or the best therapy. Also, I like ones that are smooth. Some of them have a bunch of bumps and a bunch of little nubs on them. That can be a bit aggressive on things like the IT band. So we will show how to foam roll that with Darius here. So what he's gonna do, he's foam rolling his right IT band right now. So he's got, you can see how he's got his bottom leg nice and straight, and then he has his top leg up here in this kind of 90-degree position as a stabilizer. So Darius, actually, can I have you go down to your forearm on that one? Perfect. So this is going to give you a little bit more stabilization rather than being up in a full plank. And then all he's going to do is roll all the way along that IT band, all the way towards the knee, and then glide all the way back. And the IT band can be a little bit painful. This should hurt, but it shouldn't be super painful. So what I tell a lot of my patients is just kind of roll up and down. If you find some spots that are more tender than others, feel free to hang out and just kind of hold some pressure there for about 10 seconds, and that'll help release some of that muscle tension.